Hey guys, we are going to talk about something I actually have experience with, which is Osgood-Schlatter disease. This actually happens typically in young males and normally will resolve, but what a lot of people don't realize is that this can actually happen um, in later adult years, college athletes, anybody typically that is doing a lot of running, jumping, squatting. So those activities correlate with the kids as well as with the adults. But the reason it's more common in kids is that typically at this age they have a growth plate open. We have our anatomical model here. We have our femur, patella, tibia, fibula, and then there's a tibial tuberosity here. And the quadriceps muscles are a big group of muscles, and they create a lot of force. And they come down through this area and attach all at one point on the patellar tendon. And so anytime you're running, jumping, squatting, you're exerting a lot of pressure on that tibial tuberosity. And actually, another name for Osgood-Schlatter disease is a traction apophysitis. So apophysis is basically just the growth plate, itis is inflammation, and traction is basically a pulling motion. So anytime you're exerting that force, you're exerting a traction force at this spot. And since the growth plates are open, it can um, pull so hard that you're actually weakening the integrity of the attachment. You can actually have pieces of bone that will pop off. But the real kicker here is that the attachment is weakened. And so one of the approaches we do here at Otten Medical is we work with connective tissue and ligaments, tendons, connective tissue that surrounds the joint. It is our main goal is strengthening the connective tissue. And so this is a particular disease that we feel very comfortable with, and we're very happy to have people come in to help them out, because typically sometimes patients get into a rut where they're not seeing progress and the conventional approaches aren't getting them there. One approach we do is prolotherapy. If you don't know what prolotherapy is, you can actually go back to a video that I made on the Otten Medical website blog that explains what prolotherapy is. But long story short is, if you go to some of the conferences of the groups that were teaching prolotherapy from the beginning, one of the biggest principles that they talk about with prolotherapy is how it strengthens the enthesis. This is typically with ligament attachments, but the similar principles apply with tendons as well. And so, any place a tendon or a ligament attaches, it's a spot of weakness. It's usually the weakest point in that whole complex, because you're trying to attach a softer connective tissue to a harder bone. And so we target these areas very heavily to strengthen them and hopefully improve that connection. And so if this is something you've been struggling with, it is something we feel very comfortable with. And so, yeah. All right. Have a good day, guys.